Hi, good morning, Patrick. My name is Mihiraa. Let's start the warm-up session. Do you think nurses should attend continuous nursing education?
Yes, I do. The continuous nursing education program helps nurses to update themselves with the current practices in their profession. Moreover, nowadays, it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
What is your career goal after reaching your dream destination?
Right now, I do not have any clear management goals. I am very interested in learning about management and leadership and would be interested in any committees that I could participate in and learn. I have lots of ideas and would love to be in a brainstorming group, and I am very interested in the management dynamics of the organization. I feel that I need to join leadership groups to learn and meet new people.
What are the pieces of advice for the upcoming nurses?
As a nurse, I can give a bunch of advice to upcoming nurses. Firstly, I advise them to love their profession. If anyone loves their profession, they can carry out their responsibilities in an efficient manner without complaints. Apart from that, I advise them to be dedicated to their profession and maintain professional standards. These are essential because a nurse should abide by nursing ethics on any grounds. These are a few pieces of advice that I would like to give to future nurses.
What are the qualities that a nurse should possess?
Of course, a nurse should possess a variety of qualities. First of all, she should possess excellent communication skills, which help them not only to gather clinical data, but also to maintain an effective relationship with other team members. Secondly, problem-solving and critical thinking skills are essential for nurses to deal with emergencies and difficult situations. Other qualities such as punctuality, dedication, honesty, and competency are also pivotal for nurses.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Your preparation time is over. You can now start your role play.
Hello, Mihiraa. I can see you're feeling uncomfortable right now, and I'm really sorry you're in pain. My name is Patrick Holland, and I'm the nurse looking after you today. I've come to talk with you about managing your pain after your knee surgery. To begin with, could you tell me more about the pain you are experiencing right now?
Thank you, Patrick. The pain is about a 7 out of 10. I did take the pill they gave me this morning, but it doesn't seem to help much. I tried to get up to use the bathroom an hour ago, and I think I twisted my knee a little by accident. Now it feels much worse.
I hear that the pain is quite severe and that getting up made it worse. Thank you for telling me that. Mihiraa, I completely understand that you are feeling worried about the pain, and I want you to know that what you are experiencing is very normal after knee surgery. Let me explain gently why your knee hurts right now. The pain comes from a few different things happening inside your leg. First, there is swelling, which means extra fluid collects around your new knee joint and pushes on the nearby tissues. Second, you have stiffness because your knee has not moved much since the operation, and that tightness can feel sore. Third, there is inflammation, which is your body's natural healing response, sending blood and healing cells to the area, but that process also causes warmth and discomfort. Finally, you have nerve sensitivity because the surgery affects tiny nerves in your skin and deeper layers, and those nerves can send pain signals even when the tissue is healing properly. The good news is that we can manage all of this together. I recommend a simple pain relief regimen for you. Please take your prescribed painkillers exactly on time, every 6 hours, even if the pain feels low at that moment, because staying ahead of the pain works much better than waiting for it to become severe. Also, apply an ice pack wrapped in a thin cloth to your knee for 15 minutes every 2 to 3 hours. This will reduce swelling and numb the sore area. Finally, rest with your leg raised on 1 or 2 pillows so that your knee is higher than your heart, as this position helps fluid drain away from the joint and lowers the pressure inside. Mihiraa, these steps will make a real difference for you.
That makes sense. I haven't been using ice because nobody told me, and I just let my leg lie flat on the bed. Surely, I'll do as you advise.
Now, Mihiraa, let me share some additional pain management techniques that will help you move safely and reduce discomfort. When you need to get out of bed or walk to the bathroom, please use your crutches or the walker every single time, because these devices take weight off your new knee and prevent sudden jolts that can cause sharp pain. It is also very important to maintain proper posture. When you sit, keep your back straight and your knees slightly bent, but not twisted, and when you stand, try to keep your weight evenly on both feet with the walker supporting you. You must avoid high-impact actions like jumping, running, or twisting your body suddenly, as these can flare up the inflammation and set back your healing. Now let me talk about pain-reducing exercises, because gentle movement is actually your friend. I recommend starting with gentle knee movements such as slowly bending and straightening your knee while you lie on the bed, but only moving as far as your comfort allows without forcing through sharp pain. Most importantly, please follow your physiotherapy plan exactly as the therapist explains, because those exercises are designed step by step to strengthen your knee, improve your range of motion, and actually lower your pain over time rather than increase it.
I was scared to move my knee because I thought it would hurt more. But you're saying gentle movement is actually good? I will try to follow the physio plan. What about my wound? I haven't looked at it much.
That is a very good question, Mihiraa. Let's discuss wound care now. You need to keep your incision site clean and dry at all times. When you shower, cover it with a plastic bag or a waterproof dressing and gently pat it dry afterward without rubbing. You should watch for signs of infection, like redness spreading around the wound, warmth that feels hot to the touch, or any discharge, such as yellow or green fluid or pus, coming from the incision. If you see any of these, please tell me immediately. Now, do you have any other concerns or questions that you would like to ask me?
I don't have any other questions right now. I'm just worried. How will I know if things are getting really bad and I need urgent help?
That is very important to know. So let me stress when you should seek medical help. Mihiraa, you should call a nurse or doctor if your pain is not relieved by your painkillers even after taking them on time. If you develop a fever above 38 degrees Celsius or 100.4 degrees Fahrenheit, if you notice excessive swelling that makes your knee look twice its normal size or feels very tight, if your leg becomes numb or changes color, or if you have trouble breathing or chest pain. If any of these happen, do not wait. I also want to offer that you can always press the call bell beside your bed and another nurse, or I will come to help you or contact the doctor for you.
Thank you, Patrick. That is very reassuring. I understand now.
Let me summarize everything we discussed for your clarity, Mihiraa. We started by talking about your pain, which you rated as 7 out of 10, and you told me that you took your morning pill, but it didn't help much, and that you accidentally twisted your knee when getting up to use the bathroom. Then I explained that your pain comes from 4 main causes: swelling, stiffness, inflammation, and nerve sensitivity, all of which are normal after knee surgery. To manage this, I recommended that you take your prescribed painkillers on time every 6 hours. Apply an ice pack wrapped in a cloth for 15 minutes every 2 to 3 hours, and rest with your leg raised on pillows so that your knee is higher than your heart. I also advised you to use crutches or a walker every time you move to maintain proper posture and to avoid high-impact actions like jumping or twisting. For pain-reducing exercises, I suggested gentle knee movements like slow bending and straightening, and to follow your physiotherapy plan exactly. We then discussed wound care, where you need to keep your incision clean and dry, and watch for signs of infection such as redness, warmth, or discharge. Finally, I stressed that you should seek medical help immediately if your pain is not relieved by medication. If you develop a fever, if you notice excessive swelling, numbness, color changes in your leg, or if you have trouble breathing. I also reminded you that you can press the call bell anytime for help. Do you feel clear about everything we discussed, Mihiraa?
Yes, of course. You explained everything very clearly. Thank you so much, Patrick.
You are most welcome, Mihiraa. I will check on you again in 1 hour. Rest well.